The best home remedies for baby constipation. Babies often go a long time between bowel movements. Most of the time, it is normal for a baby to go days or even more than a week without a bowel movement. However, a baby may sometimes be constipated and need a little help. Home remedies for constipation in a baby include 1. Exercise. Moving a baby's legs can help relieve constipation. As with adults, exercise and movement tend to stimulate a baby's bowels. However, as babies may not be walking or even crawling yet, a parent or caregiver may want to help them exercise to relieve constipation. The parent or caregiver can gently move the baby's legs while they are lying on their back to mimic the motion of riding a bicycle. Doing this may help the bowels function and relieve constipation. 2. A warm bath. Giving a baby a warm bath can relax their abdominal muscles and help them stop straining. It can also relieve some of the discomfort relating to constipation. 3. Dietary changes. Certain dietary changes may help constipation, but these will vary depending on the baby's age and diet. While breastfeeding a baby, a woman could eliminate certain foods, such as dairy, from her diet. It may take some trial and error to identify the dietary changes that help, and it is quite possible that changes in the diet will have no effect on the baby's constipation. For formula-fed babies, a parent or caregiver may want to try a different kind of formula. It is best not to switch to a gentle or dairy-free formula without consulting a pediatrician first. If one change does not make a difference, continuing to try different formulas is unlikely to help. If an infant is eating solid foods, parents or caregivers should look to introduce foods that are good sources of fiber. Many fruits and vegetables can help stimulate the bowels because of their higher fiber content. Good food choices for babies with constipation include skinless apples, broccoli, whole grains, such as oatmeal or whole grain bread or pasta, peaches, pears, plums. 4. Hydration. Young infants do not typically need supplemental liquids as they get their hydration from breast milk or formula. However, babies that are constipated may benefit from a small amount of extra liquid. Pediatricians sometimes recommend adding a small amount of water or, occasionally, fruit juice, to the baby's diet when they are over 2 to 4 months old and are constipated. 5. Massage. There are several ways to massage a baby's stomach to relieve constipation. These include, using the fingertip to make circular motions on the stomach in a clockwise pattern. Walking the fingers around the navel in a clockwise pattern. Holding the baby's knees and feet together and gently pushing the feet toward the belly. Stroking from the rib cage down past the belly button with the edge of a finger. 6. Fruit juice. A small amount of pure apple juice can help soften stool. After a baby reaches 2 to 4 months of age, they can have a small amount of fruit juice, such as 100% prune or apple juice. This juice may help treat constipation. Experts may recommend starting with about 2 to 4 ounces of fruit juice. The sugar in the juice is hard to digest. As a result, more liquid enters the intestines, which helps soften and break up the stool. However, a parent or caregiver should not give fruit juice to a baby for the first time without consulting their pediatrician. 7. Taking a rectal temperature. When a baby is constipated, taking the baby's rectal temperature with a clean, lubricated thermometer may help them pass stool. It is important not to use this method very often, as it can make constipation worse. The baby may start not wanting to pass a bowel movement without help, or they may begin to associate having a bowel movement with discomfort, leading them to fuss or cry more during the process. Anyone who feels as though they often need to use this method to help the baby have a bowel movement should talk to the baby's doctor. Signs that a baby is constipated. As infants may go for extended periods without a bowel movement, it can be hard to tell if they are constipated. Signs that indicate constipation in a baby include Infrequent stools that are not soft in consistency, clay-like stool consistency, hard pellets of stool, long periods of straining or crying while trying to have a bowel movement, streaks of red blood in the stool, lack of appetite, a hard belly. Signs of constipation in babies vary depending on their age and diet. A normal bowel movement before a baby begins eating solid food should be very soft, almost like the consistency of peanut butter or even looser. Hard baby stool prior to solid food is the most obvious indication of constipation in babies. At first, breastfed babies may pass stool, often since breast milk is easy to digest. However, once a baby is between 3 and 6 weeks old, they may only pass a large, soft stool once a week and sometimes even less. Formula-fed babies tend to pass stool more frequently than breastfed babies. Most formula-fed babies will have a bowel movement at least once a day or every other day. However, some formula-fed babies may go longer between bowel movements without being constipated. Once a parent introduces solid food to a baby's diet, a baby may be more likely to experience constipation. A baby may also be more likely to become constipated if a parent or caregiver introduces cow's milk other than formula to their diet. When to see a doctor. A doctor should assess a baby with ongoing constipation. It is advisable to call a pediatrician if a baby has not passed a stool after a day or two and there are other signs present, such as blood in the stool, the baby seems to be irritable, the baby appears to have abdominal pain, there is no improvement in the baby's constipation after taking steps to treat it. Treatment typically starts with home remedies. If home remedies do not work, a doctor may examine the baby and, in rare cases, prescribe medications, such as laxatives, enemas, suppositories. People should never give these medications to a baby unless a doctor prescribes them.